Chapter 17, Nutrition During the Growing Years, Screencast 3. Now, the focus of this screencast is going to be the feeding of babies, human milk, and formula. Human milk, or iron-fortified formula with internal nutritional stores built during fetal life, should meet an infant's nutritional needs until 4 to 6 months. Breastfeeding or formula feeding is a personal choice. It is, though, recommended that infants should be breastfed for the first 6 months. Human milk is most ideal and desirable source of nutrients. Breastfeeding for any amount of time is beneficial. One thing that's important here is the nutrient composition and bioavailability of human milk that's engineered for human babies. The protein includes immune factors, enzymes, lactoferrin. Fat is all there, high in cholesterol, linoleic acid, doxahexaenoic acid, carbohydrates, primarily lactose, and that shouldn't be surprising since we are looking at human milk. Now, this table here is a comparison of human milk versus cow milk, and it's per liter. So that's important. We're talking about a liter of milk. Total protein, you can see a big difference with cows having almost 40 grams and human milk only about 10.6. More fat in human milk. There's a greater degree of lactose in human milk. But then when we start looking at calcium and phosphorus, significantly greater amounts of these two minerals per liter when compared to human milk. Now, iron-fortified infant formulas are safe, nutritious alternatives. Please keep that in mind. Nutrient content is regulated by the Infant Formula Act of 1980, and it's set to match composition of human milk as much as possible. Infant formulas generally will contain lactose or sucrose for the carbohydrate. Vegetable oils make up the fat, and there'll be modified proteins from cow milk, soy, or meat found in infant formula. Now, they will differ in terms of health benefits. Breastfed babies have a reduced risk of asthma, leukemia, obesity, diabetes, chronic intestinal diseases, misaligned teeth, ear infections, and respiratory infections. Cost, human milk is less expensive. Convenience, less preparation needed when feeding from the breast. And the mother-child bonding that occurs from breastfeeding. Infants usually need about 2 or 3 ounces every 2 to 4 hours. So it's important at the very beginning to follow this closely to ensure feeding and weight gain are normal, especially during that first week of life. Do not encourage babies to eat more than desired. This teaches them to overeat. It may result in stomach pain, so watch for signals that the baby is satisfied. These would be turning the head away, being inattentive, falling asleep, or becoming playful. A well-fed, breastfed infant should have 6 or more wet diapers daily, show signs of normal weight gain, and generally pass 1 to 2 stools per day. Burp the baby after 10 minutes of eating or feeding 1 to 2 ounce from bottle. When preparing the bottles, all equipment used to prepare, store, and/or feed babies should be thoroughly washed and rinsed. Prepare the formula exactly as indicated on the instructions. Use only clean, cold water. Hot water will pose a risk of lead content. Boil well water prior to using. Prepared formula and breast milk can be refrigerated for 1 day. Human milk can be frozen for several weeks. Discard any leftovers in bottle. They have been contaminated with bacteria and enzymes. Here is an overall summary physical and eating skills, hunger and fullness cues, and appropriate food for children 0 to 24 months of age. I'm not going to go through these 2 slides. Please take the time to familiarize yourself with them. And on the review sheet, I will be very specific with regards to any of these that I would like you to be really comfortable with.